Hello, my name is Dr. Russell Foulk at the Utah Fertility Center, and I'd like to talk about COVID and how it relates to reproductive health. On March 11th, 2020, the World Health Organization declared the coronavirus, or COVID-19, to be a worldwide pandemic. That was just 3 weeks ago, and yet since that time it seems like forever because there have been so many remarkable changes that has occurred in our lives. There's been travel restrictions and quarantines and school closures and businesses closing. Virtually all commerce has stopped worldwide, which has destroyed and hurt a lot of economies. If you watch TV, the only thing you hear about are these scary stories about COVID. In medicine, we have a saying, and that is the treatment should never be worse than the disease itself. And I'm afraid we're actually letting the virus get to that point. As a physician and a caregiver, it saddens me to see the fear, the panic, the hoarding, and the social isolation that's occurring in our world today. COVID is indeed a deadly virus, especially to those over 65 years old. But for the reproductive age group, for those under 45 years old, it's not that bad at all. The case fatality rate, which is the chance of dying if you get infected with COVID-19, is estimated to be 0.1%. That's 1 in 1,000. And that number is expected to fall as we learn about the many people who might have infections but show no symptoms. And of those that get infected, the severity is not that great in the vast majority of people. 80% have mild to moderate symptoms, and over 90% can be treated at home with over-the-counter remedies. By way of perspective, the National Safety Council estimates that the risk of dying from a motor vehicle accident is 1%. That's 1 in 100, or 10 times higher than the risk that we see with COVID right now. This does not keep us from driving our cars. We understand that risk is a part of life, and we take those risks and find what's going to improve our lives. Fortunately, for people that are under the age of 45 years old, the vast majority have minimal symptoms, which should give us hope and reassurance that we will get through this together. And at the Utah Fertility Center, we will continue to treat and help those on their journey to build a family. For those that are already pregnant or are currently undergoing treatments, the preliminary data that we've seen so far has been very reassuring. Of the initial cases that were noted in China of babies that were born to infected mothers, it looks like the risk of infection to the baby is about 10%, but all of them cleared the virus and were healthy by day 6 of life. This is a challenging time with this COVID virus and the news all the time. All we hear about are negative comments. But keep in mind, we've survived a pandemic before. 11 years ago, during the swine flu epidemic, or H1N1 virus, approximately 61 million Americans were infected, and over 12,000 Americans died. But we got through that also without affecting our lives so severely. Like COVID-19, the H1N1 virus was a deadly virus too, but we continued to help and treat our patients on their quest to a family. We at the Utah Fertility Center understand the severity of the COVID pandemic that's occurring right now, and we have taken every precaution to minimize its spread. We encourage you to move forward during this terrible time with hope and not fear, and we at the Utah Fertility Center are here to help you on your journey to achieve that dream. Thank you, and best of health to all.